Your period has changed by 3 days. Is it fine? Is that all right? You notice on your tracker app, like, my period came 3 days early, or my period came 3 days late. What does this mean? Does this mean I'm perimenopausal? Does this mean something's wrong? You go to your healthcare practitioner, and what do they say to you? Totally normal. That's fine. It's okay. It still fits in the average, which is true. The average cycle length is kind of long. It's big. It's 21 to 35 days. That's acceptable. But for you, you're like, but this is weird. So is it fine? That's what I want to talk about today. I want to kind of walk through, what does it mean? Is it perimenopause? And what are other options you could look for to like help maybe get you back on track if it's not perimenopause? Not everything is perimenopause. Okay, as I said, the average cycle length, or I should say the acceptable cycle length, is 21 to 35 days. I tell you what, if I had a period every 21 days, and I know women out there who do, I'd be annoyed. I'd be like, 21 days again? Just after 3 weeks? No, thank you. On average, we want about 4-ish weeks, let's say. Now, the definition of early stage perimenopause, according to research and in a straw workshop, is that if your cycle changes by 7 days, you are considered early perimenopause stage. Not early perimenopausal, but you're like in the early stage of it. Most women don't change by 7 days. Most women don't go regular, boom, 7-day change. Most start to change by 3 or 4 days, then it goes back to normal, then 3 or 4 days, then it goes back to normal. You may notice you do change all of a sudden by 7 days. But on average, the most feedback I get is like, yeah, it's getting a little shorter, it's getting a little longer. But that is the definition of, are you in early stages of perimenopause? When we think of our period, we think of it as a vital sign. So like when you get your heart rate or your blood pressure, those are all vital signs. For women in particular, the regularity and the way that your cycle and period are also considered a vital sign. In fact, there's a whole wonderful book called The Fifth Vital Sign, and it's all about your period if you are new to your period. But weirdly, science doesn't often take it as a vital sign. I think of it as a vital sign. My colleagues in the space of functional, integrative, holistic naturopathic medicine think of it as a vital sign. It's immediate feedback that something might be going on. So think of it as a vital sign. You're changing. If you've had an acute thing come up, you have acutely been ill this month. So next month is going to be, your period changes by 3 days. You traveled big. You had a hot girl summer in Europe. You went to Japan. Like you changed several time zones and it stayed, versus just like east to west coast. Not many women get too messed up in their period just going east to west coast, but like big time zone changes, you may notice your period changes. If you have had big stress, big things at work, big things with your kids, big things in your relationship, you've moved, you've like big stuff in your company, like those big changes can actually absolutely acutely change your period. It may change by a couple days shorter or longer, and then hopefully once it's over, it changes back. If you've had a new medication, certain medications may screw up your hormones. It'll screw up your signals. It'll screw up things in your brain. And all of a sudden you're like, oh, I needed this new medication, but it did screw up my cycle. Like, for example, let's say you were sick and you had to go on antibiotics. Being on sick with an antibiotic, you may notice your period changes. That is, again, it's a vital sign. It's feedback. Something changed in the system, your system. So the period shifts. But if it shifts back, that's good. That means it's resilient and like could bounce back. Here are some reasons if you start to notice you're shifting by a couple of days that seem out of the ordinary. Now it's consistent. You look at your app and you're like, dang, I used to be a 28-day girl and now I am a 25-day girl. Or dang, I used to be a 27-day girl and now I'm a 35-day girl or 33-day girl. This is not my typical, but I'm noticing it's my new typical. What could be going on? Obviously, perimenopause could be a reason. Perimenopause with the shift in hormones due to the decline in follicles in our ovaries means that the signal to do the things on time from the brain down to the ovaries doesn't always get received. So the period can come sooner than later or later than expected. And that could be the new normal. I will give you my example. Classic. I was a 28-day girl. For ever and ever and ever, years and years, decades, I was a 28-day girl. One day I looked at my app and I realized at some point along the way I'd missed 2 days and I was now a 26-day girl. And I'd been a 26-day girl consistently pretty much since my early 40s now. Now I'm in my late 40s. In fact, I'm almost 50, but I'm still consistently about a 25, 26-day girl. I haven't gone back to 28 days. And my app was like, yeah, well, you used to, but the new you is to be shorter by about 2 to 3 days, sort of depending. Now, if you're like, is there anything else? Yes, not everything is perimenopause, or you can have two things happen at the same time. You can be perimenopausal, and if you have a hypo or hyperthyroidism issue, even if you're on the wrong medication, underdosed, overdosed, underdosed or overdosed on the supplements you're taking, anything around your thyroid, an immediate feedback of the thyroid is usually to mess up your cycle. And there you go. Like, it could be a thyroid problem. So it may be a new thyroid problem if you've never had one, or if you have one, you may be nodding your head thinking, yep, I could tell immediately I'm on the wrong dose or my thyroid was a problem based on the way that my cycle acted. If you've had chronic stress, I mentioned the one-off stress acutely, but let's say you are in a season of chronic major stress. It may be big moves, maybe relationship changes, maybe you have a sick child that's ongoing. Maybe you yourself have chronic disease, chronic autoimmune that you can't quite get under control yet. Maybe it's like just life and everything I said added up together, and you've noticed there was some sort of kickoff and then it's sort of, quote, never been right since. Chronic stress can do that because chronic stress is releasing the chronic stress hormones, epinephrine, which is known as adrenaline, and cortisol, going to the brain, and that can shift signals in the brain down to your ovary and therefore impact your menstrual cycle. It can make it shorter, it can make it longer. If you have had any kind of head injury or traumatic brain injury, you've been in a car accident, you play sports, your kid accidentally bumped you in the head, you fell and hit your head, like anything around the head. Remember, all the signaling starts in the head, all the feedback starts for the head. It's possible if you're like, yeah, you know what? Ever since that car accident, my periods have been wonky. That could be a common reason. If you have had any kind of surgery anywhere in the body, you had your gallbladder removed, you had your appendix removed, you had, even if you had your uterus removed, but you still have your ovaries, that can absolutely change your cycle. Just because surgery itself can be quite stressful, the surgeon is moving and pushing things around, and just by default, it can impact the ovaries. So if your surgery was cosmetic, maybe it was a big cosmetic type surgery that required you to be down for a couple of weeks, like that can absolutely give feedback to the brain to say like, hey, that fifth vital sign, the cycle, not our priority right now. Healing is our priority, and making sure the menstrual cycle is good is not. So just keep that in mind. Medication, I mentioned if you started a new medication, it's possible that it can mess up your cycle temporarily, but other medications might really mess it up. Opioid pain medications, steroids, the big one, chronic antibiotic use. If you are treating something, let's say like Lyme disease, and you were on an antibiotic every day, that's part of your treatment, do know that that could be shifting your menstrual cycle, as an example. And I don't mean medications like hormone related, like the birth control pill. Of course, it's going to change it's going to regulate your bleeding. But if you're like, yeah, I got an IUD in, or I'm on the birth control pill, or I started hormone therapy, like that's a little different because it's like the hormones themselves. I'm talking outside of the hormone realm, outside of the ovarian realm. What else could be messing with this vital sign of your period and your cycle length? Prolactin is a hormone that we commonly think of prolactation. If you have had babies and you've breastfed, prolactin is the hormone that helps you make milk so you can breastfeed. But you can have high-ish or medium high-ish levels of prolactin due to other reasons. Now, the worst case scenario, but it's not really like worse, is a prolactinoma, which is a tumor in the pituitary, but it's not cancerous. So it's more of a tumor that increases the production of prolactin. But thank God, like it's not brain cancer, as an example. But we do need to manage that tumor. We either have to go in surgically remove it, or there are medications to help suppress it. Well, prolactin, when it's elevated, can screw up the signals in the body. So it's like, are we breastfeeding? Are we not breastfeeding? What are we doing? And it can change the cycle. Now, other non-tumor reasons for high prolactin are things like, surprise, hypothyroidism. Hypothyroidism can slightly increase prolactin. having low levels of dopamine, having low levels of vitamin B6, transient high stress, high adrenaline, high cortisol can transiently increase prolactin. So you may find somebody does a prolactin check on you, which is an easy blood test. It's not a very rare or wild one. It's pretty common, generally commonly covered by insurance if you're having some cycle changes. And you may see your prolactin is a little higher than the range, not a lot higher, but a little higher. And then your doctor may go, oh, we should examine this. Like, let's make sure it's not worst case scenario, but also maybe it's a B6 deficiency. Maybe you do have a thyroid problem. We should look at that. Maybe it has been stress. Again, that prolactin can screw up your period. Another thing that's not commonly discussed is lymphatic and blood flow. You have a lot of lymphatic and blood flow down to the ovaries. And so if you've had surgery, you had a C-section, you had your uterus removed, you had an appendectomy or appendix removed, you've had anything that's going to impact blood flow or lymphatics down to the ovaries, you may find that that's going to impact your cycle, because lymphatics and blood flow are what carry hormones and what carry signals to the ovaries and away from the ovaries. So anything that's happening in and around that lower pelvic area, that's going to impact basically like the transportation system, which are your lymph vessels and your blood vessels, then signals may not get there and hormones may not leave there like they're supposed to. So if that sounds familiar, like, oh my gosh, yeah, I had my appendix removed like 3 months ago, that makes sense. Or, oh yeah, I had a hysterectomy, kept my ovaries, but it was, of course, through the abdomen, and I have this big scar now. Maybe you had a mommy makeover, and you're looking great, feeling great, but that scar that's down the smiley face scar down at the bottom in the pelvic area, can impact potentially lymphatic and even nerve and blood flow there. And so improving that through manual sort of physical therapy could be really helpful. If you're over exercising can give the signal to the ovaries of we're going to shift the cycle a little bit. It usually impacts ovulation negatively. So if you've suddenly started doing pretty heavy exercise most days of the week, or 2-a-days, meaning in the morning and the afternoon, really long, heavy exercising, and you are under eating, or you're just under eating in general chronically, those also give signals back to the brain that it's going to impact your cycle. There are a whole lot more examples, but I just wanted to give you these examples of oh, not everything is perimenopause, or it could be perimenopause and I would hate for you to miss the and. I would hate for you to miss that you actually have a thyroid problem. I would hate for you to miss that you have a B6 deficiency and it's impacting, prolactin, and that's what's causing it. I would hate for it to be missed that you've been chronically under eating. Maybe you didn't mean to at all. It's just you're in a busy stage of life. Maybe you're on a GLP-1 or, and as a result, you have no hunger cue anymore and you're not eating as much as you used to. And therefore it's impacting your menstrual cycle. Maybe it's chronic stress. Maybe you have had a surgery in the last couple of months and you're like, you know what? That's what it was. I thought it was age. I thought it was perimenopause, but it's entirely possible it's post-surgical recovery. So by understanding this, it can help you just define further, okay, your period has shifted a couple of days, shorter or longer. Is this expected and acute? Is this something that's more chronic that I should probably turn over some more rocks, talk to my healthcare practitioner about? Is this perimenopause, or is it a combination? Because obviously several things can be happening at the same time. And then by getting your period back on track, potentially, again, fifth vital sign, then you get okay, everything's good. Now I'm back to being my regular whatever you were, 28 days, 30 days, 27 days, 26 days, etc., versus shifting. So keep track. Keep it in your calendar, in your phone, in an app, somewhere, because this shift in the menstrual cycle is immediate feedback to you that something is changing. 1 month, probably not a big deal. Probably something just acutely that happened. Once you start noticing patterns month after month after month, now it's feedback for you. And again, don't assume everything is perimenopause, because I would hate for you to miss something else going on. Now, here's why. Hormones feel like herding cats, don't they? When your cycle shifts by a few days and you get told, oh, that's normal because the average menstrual cycle is 21 to 35 days, you're like, what? That seems like a massive range. But for you in particular, it doesn't mean the entire range applies to you. If you've always had a regular cycle or regular-ish, It doesn't mean if your regular cycle was 35 days and suddenly you swing into 21 days, like, oh, that's still in the range. It doesn't mean it should be in your range. That is a big drop, and I would want to know about it if I was your doctor and work you up to figure out what's going on.